Hi, I'm Bailey Burke. I'm a student at the UT Health Sussex School of Nursing, and I'm in the D&P program, and I will be discussing billing for advanced care planning services to comply with federal requirements. Advanced care planning, or ACP, is the face-to-face time a clinician spends with a patient, family member, or surrogate to discuss or explain advanced directives. ACP services are time-based and subject to several current procedural terminology, or CPT rules, set forth by CMS, leading to confusion when billing for these services. As the population continues to grow in age, advanced care planning is needed to align patient goals and expectations with their plan of care. This certification will provide tools to properly bill for ACP services to comply with federal requirements and have continued success in your practice. Amongst other medical services, ACP is a service that providers can bill Medicare and other insurance companies for. It is the responsibility of the provider on record and the billing organization to know the guidelines regarding policies covering billing and collections. Although services are billed for everyday practices, compliance to federal requirements is still a common issue in healthcare. In order to review compliance, audits are conducted by the U.S. Department of Health and Human Services. Medicare payments for ACP provided from 2016 to 2019 totaled more than $340 million. They found Medicare providers did not always comply with federal requirements and resulted in millions of dollars in overpayment from CMS. This is a poor practice management technique as it is not efficient or effective to operating a healthcare practice. Billing mistakes take time away from patient care and risk financial loss. Overseeing the entire financial process from patient check-in to billing, claims, submission, and reimbursement is part of effectively managing a practice. In order to fulfill federal requirements, healthcare practices must learn the documentation and time requirements for ACP services to prevent healthcare fraud, whether intentional or unintentional. Systemic changes in management practices may increase accurate documentation of ACP services and decrease overpayment by CMS. The first change would include understanding CPT codes. The American Medical Association came up with CPT codes in 1966, and they are registered and trademarked. Depending on the method or service, each unique code refers to a certain service and is converted into a numeric or alphanumeric code. Since January 1st, 2016, certain CPT codes have been recognized by CMS with intention to incentivize clinicians to engage with their patients in ACP discussions earlier and with more frequency, as ACP helps guide patient-centered care and engages patients in their care plan. Understanding how to bill for these services will increase ACP reimbursement and protect clinicians from unintentional healthcare fraud and overpayment for services by CMS. Knowledge and compliance issues helps to decrease the risk of malpractice claims and insurance fraud and abuse, and can save an organization from a costly lawsuit. There is no limit on the number of times that ACP services can be reported for a given patient in a given time period. However, if these services are billed more than once, a change in patient's health status and/or wishes about end-of-life care must be documented. CPT code 99497 is used for the first 30 minutes of ACP, which includes explanation and discussion of ACP by a qualified healthcare professional. This is a face-to-face discussion with the patient's family members and/or surrogate, and the code 99498 is used for each additional 30 minutes. At a minimum, appropriate documentation must include the content and the medical necessity of the ACP-related discussion, the voluntary nature of the encounter, the content of any advance directives, the names of the participants in the discussion, and the time spent in the face-to-face encounter. Another way to remain compliant in billing for ACP services is to proceed with frequent internal audits prior to the U.S. Health and Human Services audits to avoid owing the federal government back pay for overbilling. Internal checks are useful in ensuring adherence to federal requirements. An internal audit would verify that billing and coding practices align with up-to-date CPT codes and guidelines. It could check for accurate documentation, appropriate code usage, and proper reimbursement procedures. Conducting regular self-audits could help identify areas of non-compliance and address them promptly. Conducting regular self-audits will not only help maintain federal compliance, but also contribute to the overall improvement of healthcare practices and patient outcomes. Additionally, practices could consider seeking legal or compliance expertise to ensure a thorough and accurate audit process. The Center for Medicare and Medicaid Services and the U.S. Department of Health and Human Services websites offer a wealth of information to help practices adhere to regulations and is a great resource for any questions regarding billing, especially for services like ACP. Although underutilized, ACP is important in providing patient-centered healthcare. Understanding the requirements and correctly utilizing CPT codes set forth by CMS will help the provider comply with federal requirements when billing for ACP and increase patients that receive it. Effective practice management is crucial for healthcare to run their practices successfully, maintain financial stability, deliver high-quality care, and enhance patient experiences. It is the responsibility of the provider on record and the billing organization to know the guidelines regarding policies covering billing and collections. Thank you for taking the time to listen to my presentation, and these are my references.